Everyone, today I'm going to talk about the 3 ways to pay for long-term care. Hi, my name is Eric Screwala, and this is something that you should be aware of, not just for yourself and what your future needs may be, but we all have parents that are getting up in years, and understanding how they're going to pay for long-term care is an important thing to think about as well. So there are really 3 ways that you can go about doing this. Now, number one, and probably the most economical way, is to purchase a long-term care insurance plan. This is a plan that will cover stays in a nursing home or provide other skilled services if you need it in the future. The earlier you purchase a policy like this, of course, the less expensive it's going to be. But long-term care insurance has some limitations. There's a limitation on what the benefit is going to be. And if you hit a certain age, or your health is if you have certain kinds of pre-existing conditions, long-term care insurance may not be available to you. So that brings up the second way to pay for long-term care, and that is you just pay cash. Now, there's a problem with this for most people, in that long-term care insurance in the state of New York, of course, it can fluctuate between upstate and downstate, but figure around $10,000 more if you're in the city in Long Island. Less if you're the further upstate you go, but $10,000 a month. It doesn't take much to realize you could run out of money quickly if you're paying all of it from your own assets. And of course, part of what we want to do is to make sure we leave something behind for our kids. And again, think about this in terms of what your expectations are, what your parents' expectations are. Do they expect to leave something for you? If they do, then it's something for them to really think about. Do they have the level of assets to pay for their own long-term care needs and still leave something behind for you when they pass away? And that brings up the third option that's available, and that's Medicaid. Now, most of us know Medicaid as a program that provides insurance for low-income individuals and families. But it is also the insurance program that provides long-term care for anybody who has a disability and needs it. Now, just like with the insurance aspect of Medicaid, Medicaid is an income and asset means tested benefit, which means your income has to be below a certain level and your assets have to be below a certain level. But that doesn't mean you have to be broke to access it. There are ways in which you can make plans now that will allow you in the future to qualify for Medicaid and at the same time preserve a large quantity of assets you've already accumulated over time in the way that you've always wanted to leave them behind for the next generation. So if this is something you want to think about in terms of how you would pay for your own long-term care needs, or more importantly, if this is something you think you want to talk to your parents about, let us know. We'll be happy to give you some information on how to do that, and we'd be happy to talk to your parents if this is something they're interested in doing for themselves. So until next time, take care. Bye.